I'm going to be demonstrating trach suctioning and trach care. I'm going to make sure I have all my supplies ready before I come into the room, or make sure I have my supplies when I come in the room. I'm going to have my hydrogen peroxide, my normal saline, my suctioning catheter kit or tray, sterile gloves for that, extra set of gloves if I should need that, if they're not accessible or handy in the room. Another set of sterile gloves if they're not included in my trach kit, but sometimes they are, but having an extra set's not handy. And then also my trach care kit. All right, so come into the room. Hello, Miss Dan, how are you doing? My name's Amanda. I'll be your nurse today. I'm going to do trach suctioning and your trach care today. Just make sure you do your hand hygiene. Provide for privacy. Okay. Just want to verify your name and birthday. It's Barbara Dan. Okay. Date of birth is 8160. Good. Do you have any allergies to anything? Latex? Anything like that? No? Okay. Great. All right. I'm just going to facilitate for positioning, like for breathing. I'm going to sit up. You been having like much cough or anything like that? No? All right. I want to also assess vital signs, your respirations, heart rate, stuff like that, to note any respiratory distress. Lung sounds, so you want to make sure that you listen in all lobes. Note if there's like any major secretions, copious secretions, things like that, and if there is, what color, consistency. All right. Sounds like you almost need some, we need to do some suctioning on you, so we're going to do some suctioning. I'm going to set that up and get ready for that, okay? All right, so to make it a little easier for everybody involved here, I want to make sure my trash can is right here by my foot and ready. Tray table, bedside table's up. All right, I have my suctioning tubing here. It is turned on. And I'm going to turn it up to where it says 80 to 120, around in that range. And then I'm going to go ahead, as I set everything up, and hyperoxygenate my patient. And we'll crank it up here. All right. I'm just going to have you take some deep breaths, just slow deep breaths, just regular breaths for me while I get everything ready. Okay, Miss Dan? Thank you. Doing okay? Yeah. And of course, patients may not be able to vocalize, but you can still communicate with your patient. All right, so here I'm going to be using my normal saline for the suctioning. So I want to inspect my bottle, make sure that it has not been contaminated of any kind, that it's still sealed. Even if it's been open, make sure the lid has been tight, it's not cracked in any places, and also that it is not expired. And it is a good bottle. All right, my sterile gloves. I'll set you all the way over here so you're not in the way. Okay, I'm going to open the catheter, set. You just pick this out, straight out, and open the little box. Set it right here. Okay. All right. Okay, over here. Set up, and then just pour some here. All right. And then open our sterile gloves. Still doing okay, Miss Dan? I'm almost ready to get started. Make sure that this is just not close enough that I contaminate anything with it. So this doesn't touch me. Alright, so it's better if you want to go ahead and use both hands to pull out your tube so you can wind them both around your hand. And use that to manipulate and get it ready. Alright, so you're going to have, this is, my left hand's going to be my dirty hand. And I'm going to go ahead and connect this to my tubing. Make sure it is still turned on and ready. Alright, so I'm going to just check my suctioning, make sure it is working. So I'm going to stick it down in my box and make sure it works. Yep, good, working good. Okay, wind back around here. This way it keeps it from actually falling or dropping on something. All right, Miss Dan, we'll have you take some quick deep breaths for me. All right. Okay, just want to take this away for a little bit. All right. Okay, we're going to slowly take this in, trying not to hit the sides of the inner cannula until we cough. You see coughing. All right, cough, cough. All right, then intermittent suction and twirl on the way out. Not hitting like the chin or anything, and just keeping it sterile. Then wind back up, hit this back, and let her breathe a little more. Good job. I know, I'm sorry. We're gonna go one more time, okay? All right, just a couple more breaths. Take it off. All right. One more time. And being sure not to let that touch the inside there. And we'll cough, okay? And then suction on the way out, intermittent. Okay, there you go. Good job. Okay, and you can go up to 2 or 3 times. If for some reason, if your catheter does hit anything on the way out, or if it does slip or anything, all you do is just grab a new one, and then just change your gloves, get a new set of sterile gloves. All right. Now, because this has like your sputum and all that on it, go ahead and wrap it up. You're going to dispose of it in your gloves. Keep it all contained. Okay, just kind of put it here on your other dirty glove, and then dispose of it and go away. And then you'll make sure you want to perform hand hygiene. All right, we're getting ready to go in between and do different procedures. All right. Okay, Miss Dan, I'm gonna put my stuff here to the side. I'll clean that up in just a second, okay? And we're gonna go ahead and do your trach care. You doing okay? Yeah? Did you tolerate that all right? I'll just take one more listen to you and do another set of vital signs, see if your respiration's got any better. You were a little tachypnic there for a second. Oh, lots better. Much more clear. You don't sound so gurgly now. Not hearing this much roca. All right. Okay. Okey-doke. I know initially when I had come in here, my hair was up, but it had come down. So, it had fell out. Okay. Definitely want to make sure that with your patients, you want to make sure your hair is back as possible. That stuff can get into the trach. All right. Hand hygiene again. All right, Miss Dan. I'm going to set up our trach set. And again, we're using our same saline bottle. I had inspected it. It was not contaminated. It was intact, and the expiration date was good on it. And we're going to do the same thing for our hydrogen peroxide. It had, you know, the lid is good. It is secure, and it does not expire till August of this year, so we're good on that one. All right. So we're just going to set that right there for now. Put this over here. All right, what we're going to do is open this up here for a second and just pull this out and open this up to where you have shiny side up, and then just let it fall. You don't want to contaminate your sterile field at all. Okay, and then you just want to take your contents and then just dump them onto your field. And ideally dumping them all and getting them all on there. For some reason, if you should have something that would fall out separate, then just get a new one that was in a sterile pack or whatever and put that on there. So this one that came off, that's fine. I would just get a new one. Get a new one. So we'll have the tech bring me a new one. And so she brings in a new sterile one. So I open that one up, and that one just gets plopped on there. All right. So, great. Okay. So what we're going to do is set this up. We're going to pour our liquids into our trays. We're going to use saline in the first bin, and we're going to pour our saline into the second bin. Okay. then good measure, I'm gonna go ahead, because I don't want to contaminate this, because it's all sterile, move this here. Sometimes it gets awkward depending on we'll do it this way. There we go, third tray. Before I get too involved. So I'll do that. You gotta practice this and what works for you. That's the kicker. Every place has things different. All right, and then we're going to do the peroxide in the first bin only for right now. Okay. All right, Miss Dan. I'm gonna just put my pretty purple one. These are not purple, they're pink. I'm really gonna get my colors right one day. I think it's because I really want those red ones. I'm gonna give them to me. Alrighty. Okay, so I'm giving you some oxygen. You've been taking those deep breaths still from your gut and suctioning, right? Alright, I'm gonna take it away for just a little bit, okay? I'm gonna just take this little inner cannula out. Okay, so you're gonna untwist here and then just pull straight out, not letting that inner cannula touch anything. Just come straight out, and then you're just gonna drop it into the first bin. Okay, and then you're going to take this out, the drain sponge, and it's going to go into the trash. Okay, all right, and that's it. Now, it's going to be sterile again. And wash my hands. You doing okay? She's peachy. Peachy like a nectarine or peachy like a peach? I prefer nectarine because that doesn't have fuzz on it. Your Trach does not need fuzz. I know, you're a dog. I know. Okie dokie. Again, you have to just practice these to where it's going to work for you. Can't say practice, practice, practice. Alright, so sterile gloves again. Alright, so I'm going to try to take into note because where this kind of actually crossed my field a little bit, that I'm not going to use that little corner. Okay. And then I'm just going to leave that there because I don't want to take a risk of actually contaminating anything. So then I want to set this up to where when I get ready to actually clean this Trach, I don't have to worry about cross-contaminating anything in this field. So this is one of the last things I'm going to use. So I'm just going to put this here, right there. Okay. What I'm going to do here. Now, everybody has their own ways, but this is what we found is one of the easier ways to do it. So, you can do whatever works, but okay. So, okay. Now then, when you actually work, now you're going to be working in like a clock. All right. So then I'm going to go in, reach in, grab my tray, my inner cannula, and I'm going to clean, scrubby, scrubby. Try to keep a good hold on it here. I actually want to just try to hold it by the thing. Okay, and then just kind of scrub on the inside, outside. Sometimes you can have some nice gunk there. All right, and then this is done, so it can be pitched. Then it goes in to here, and that's where it commits. Okay. And you're going to take one of your 4x4s here, and then pick this up out of here, and then you're going to rinse off the excess. Okay, and then hold it. All right. Okay, Miss Dan, I'm going to put this right back in, and then this is actually going to help you for dexterity. Put this back in. Try not to touch anything on the way back in. and as it goes in, you're just going to lock it now, okay? And it just snaps back in. All right. Now, our last little bit, we have our Q-tip with our saline, or with our 4x4. We are going to dip into our third tray with saline. All right, and then we're going to get our peroxide and pour a little bit of peroxide, make it half and half in here, because according to our policy, we are supposed to clean the faceplate and the stoma with half and half and saline. So now we're going to clean in here and dip here. All right, okay. So now I'm going to take the one that I just dipped in the peroxide and saline and clean around the stoma faceplate. All right, so you want to actually go around the stoma and faceplate, not just the faceplate, because that's two different things, not just one. And then that can be pitched. All right, and then we're going to grab the one that we dipped in the saline and go around the same thing. There we go. And then that's going to be pitched. All right. Now, I'm going to take our drain sponge. All right, Miss Ann, we're going to go right up under your trach here. Sorry, sweetie. This part's a little uncomfortable sometimes because it tugs a little bit. Your patient may cough when you're doing this because you're kind of irritating that stoma. But hopefully where you've just suctioned them out, they won't cough anything out at you. But just kind of be mindful of that. So, all right. And then also at this time, if their trach ties are, need to be replaced, you're going to replace them. But you're going to get a second nurse to help you because you don't want this to become dislodged. So you want to grab another nurse and they're going to help hold this when you change your trach ties. All right. So there will be another one involved. Okay. All right, Miss Dan. It's all done. Okay. I'm going to clean up my mess. Alrighty. You doing okay? Mm-hmm. Alrighty. Yeah. Alrighty. Good thing to put the lid back on. Yep. I'll do one more time before I walk out the door. Never be too sure. Alright, and I'll make sure that my oxygen's back down from where I suctioned. Make sure it's back down on its normal rate of what it was supposed to be. Okay. Is there anything I can do for you? I'll put the bed down. And make sure the bed's down the lowest level. And call lights within reach. Anything I can get you? No? Good. Alright, and I'll come back and assess as needed. And I think that's it.